We recognize in Durham that, and across the nation, that there are populations and communities that are at greater risk for diabetes than others. And we are very focused on trying to identify those communities and to support those communities.
One person can't address this issue, so let's all get around the table, let's all talk about what we need to do and make sure that we work in close partnership so that in 2 years, 3 years, 5 years, we can look back on the work we've done and we can say that we have truly decreased the number of diabetics in Durham County.
We are the community, and I think whatever we do in terms of our approach needs to reflect the community. So what I was seeing in terms of disparities, there was a huge gap with the care that was being rendered to African Americans and other minorities as opposed to the majority. And so with that being said, I knew that there probably needed to be a different approach.
We know that African American, Hispanic communities tend to have higher risk and higher incidence of type 2 diabetes than others. We also realize that families with less income, lower resource, have higher risk for diabetes.
We went out into the community, did lots of surveys, kitchen table, focus groups, town hall meetings to find out what the community thought they needed versus me creating a model and they wouldn't come.
Well, I've been thrilled to know that the people who live in Durham County, the nonprofits, neighborhood partners, are really interested in working with us on this project. In addition to wanting to work with us in the project, they're interested in seeing how their clientele can also become a part of the new plan that is in place to address the issue of diabetes in Durham County over the long haul.
We've determined that when we bring all of our expertise together, including the expertise of residents, people who have diabetes, individuals who care for people with diabetes, when we bring all of that expertise together, we become this wonderful resource for helping to move our community forward.
We need to have a plan, and I think that plan includes all the partners coming together. And if it's around diabetes, utilize whatever strengths we have in the community and build on those rather than reinventing the wheel.
And ultimately, partnerships really is about people and making sure that all of us are being treated in the way that we like to be treated and that the people are always at the forefront of anything that we do.
And I believe wholeheartedly that when we work well together, we can make a huge difference in diabetes in this community.
Those are just natural partnerships, and they're true partnerships. They're not paternalistic, where one person has the control and the other person basically does the work. It's everybody working together for the greater need.
So my hope is that within the next probably sooner than 10 years, but within the next 5 years, we're going to look at numbers and say, wow, we really made a difference.
So we've begun to think about how do we focus on those communities, not to the exclusion of others, but identifying where we can have the greatest amount of impact on improving the lowering of the incidence of diabetes in our community, but also helping those individuals who live with diabetes to have better outcomes.